I recommend, if you care what others think, do this at home or somewhere when you're alone. But if you don't mind being silly or looking silly, we're going to give ourselves Dumbo ears, because a lot of you are struggling with clogged ears, Eustachian tube dysfunction, tinnitus, PET, patulous eustachian tube, and it's just not getting any better. And you watch a lot of videos online and you don't seem to find that relief that you're looking for. So today we're going to give ourselves Dumbo ears. Yes, we're going to extend our ears, and we're going to do a little bit of a different technique than you may have seen online. But I can tell you right now, it's highly effective if you do it consistently. So let's get started. So the first thing you want to do is you want to take your hands and you want to grab on your earlobes. The difference in this technique is, before we start pulling away and giving ourselves big ears, stretched out ears in this sense, we're going to actually hold our breath this time. Now, I'm going to tell you exactly why we're holding our breath, but I'm going to do it after that we try this exercise. So here, let's jump in. Grab your earlobes. As you pull, hold your breath. And when you hold your breath, give yourself those big cheeks as if like you're underwater. Like when you're diving underwater and you see kids like really push the air out. Let's try that. Pull your earlobes out. Hold your breath, filling your mouth up as well. Hold it. Obviously, I have to talk in the video, so I can't completely do the exercise, but hold it for about 10 seconds if you can. Okay, ready? Let's go. And release. While still holding on to your earlobes, give yourself a good breath of fresh air now. So do not hold your breath on this one. Breathe in, breathe out. Okay, so I'm going to explain a little bit of why we held our breath. And remember, if you start to feel lightheaded, don't do this exercise right now, because maybe there's another reason to why your ears are clogging. But if you start to feel really lightheaded, remember, do not continue with the exercise. It's very important that we hold our breath briefly, because what we're doing is we're stagnating the oxygen flow. So while we're pulling our ears, we're stagnating the oxygen flow on purpose, because when we give ourselves that big fresh air, big deep breathing after the fact, we're hopefully going to draw more oxygen in and out. And then that's going to trigger more blood to this region of the ear. So by holding our breath at the beginning, it's hopefully going to increase the oxygenation levels as you start to breathe out on that next one. So I'm just going to walk you through it, but I'm not going to do the holding the breath thing, because I do want to walk you through it and talk. So as we held our ears out, we held our breath, filled our cheeks up with air, and we held it as long as we can. By long, I don't mean very long, maybe no more than 10 seconds. And then when you let go, you're still holding on to those ears, okay? We're doing that because we're trying to regulate the oxygen levels. We're trying to bring basically focus into these areas of the ear, okay? By holding the ears out, it's hopefully going to put that eustachian tube back into a good perspective, by meaning we want it to be at an angle. We don't want it to be going this way or going this way, of course. We want it to be at a good angle. So when we hold those ears, we hold our breath at the beginning, and then we completely let go. I hope that brings more blood flow to that area, while also regulating the breathe in, the oxygen level, and breathe out. Many of you are pretty aware that your ear problems aren't just a matter of going in and digging earwax out or putting eardrops in and doing those simple things that I think a lot of us already think about that. It's on the deeper surface. It's really deep into the core, actually. And I think when you really focus in on your breathing, which is what we were doing here, we're regulating those breathing levels. We're kind of structuring ourselves. We're increasing our lung capacity, which there is scientific proven facts that if you practice breathing consistently, it has a very huge advantage of getting through this anxiety. And a lot of you are dealing with anxiety when you're dealing with ear problems. They pretty much go hand in hand. And the book that I've written explains how the mind and the ears are very well interlaced. And if you can manage your anxiety, manage the depression, you're going to see some very huge and major changes in your ear and the blood flow to the ear. So by doing this exercise, you're not only securing the physical structure, you're also helping with regulating the breathing, which is going to help on the mental structure. And I have found by talking to many of you, coaching hundreds of you, it's just simply an anxiety problem. Most of the time, it's anxiety driven. And if you're not aware of that, you're going to continue to focus on the physical nature. Meanwhile, the mental nature is depleting, and you can't heal from something if you're not focusing on it. You're just simply not aware of what you need, and it's okay. But unfortunately, doctors aren't all trained to focus on the mental need if they're not that type of doctor. If you go to a medical doctor or an ENT, most of the time they're trying to look at the nature of the surrounding area of the ear or the structure possibly. But really the emphasis, in my opinion, not being a doctor, I feel a lot of it should be focused on the mental nature of things. It's not just sitting somewhere for hours meditating, but putting some action into place. Now, meditating is very important, but without the basis and why you're doing it and some structure and some consistency, you're not going to achieve the results you're looking for. So I really want to devote a lot of emphasis on really concentrating on the breathing. The breathing is going to help regulate blood flow. It's going to help with increased oxygen levels. It's going to help increase the lung capacity. It's going to help bring down the anxiety levels. It's going to help with cortisol levels. All these things are going to interlace with what you're feeling by just simply having a clogged ear. All these other things can be really perpetuating that. So I hope this video was very helpful for you. If it was, please take time to subscribe to the channel. I try to bring content as often as possible. But in the meantime, I'm going to step out of the Jaye Wellness Studio and leave you in good hands with this video. Like anything else, folks, we are here to simply go back to the basics. Take care, everybody, and I will catch you on the next video.